Hi, everybody. My name is Dr. Martin Fallopino. I'm a primary care doctor for 39 years, but on YouTube and other social media, I'm Dr. Debunk. Now, I invented Dr. Debunk so that I could debunk medical myths, garbage, and crap spread by doctors and other health professionals. So, the need is greater than ever in medicine for medicine to be debunked by doctors because there is so much politics and ulterior motives. It's so difficult today for patients to get really good medical information. Doctors seem to be in such a big hurry. Anyway, there's a lot of lies and factoids in medicine today, and this has occurred mostly because of the fact that it's become so politicalized and so monetary based. What we saw the last 3 years has really amplified it and really caused me to resurrect Dr. Debunk. There are some old videos of me doing this years ago. But what happened 3 years ago, you all remember, was the Martian virus attacked, or the Martian germ. I'm using this terminology for obvious reasons because I want to do a long series of videos to explain to everyone what really happened with the Martian germ when it attacked 3 years ago, when the world came to a stop as we know it, and the government really got all over our lives, not just patients but doctors. I mean, I can tell you when they were in full swing in 2020 with the Martian germ, they varied away from classical medicine on treating problems like this. It's not like this isn't anything new. We haven't had a pandemic of that proportion for a long time, actually since 1918. But regardless, they did not want us to practice medicine the way we were supposed to. And people have figured it out, and a lot of things have happened since then. And I'm going to go over that over the next months in great detail in these short videos so that you can have a clear understanding. What I want to do as Dr. Debunk is debunk so much of the junk that went on during the last 2.5, almost 3 years now. But before I do that, I have to give you an understanding of what medicine really is. See, Americans don't really get doctors. You guys don't get what we do. 95% of people, you have inappropriate expectations of what a doctor can do for you. And so let's start at the most fundamental levels. What is American medicine and what do doctors do? Well, they call us healthcare providers, but we're not healthcare providers. We don't know anything about health. We don't study health at all. What we do is study disease. So really, we should be called disease treaters. Doctors are not health professionals, we're disease treaters. We learn and study the early detection of disease and the diagnosing of disease and then the treatment of disease. Well, where do you hear health anywhere in that? Nowhere. That's where you hear it. Because we don't study health anything. We study disease. But you don't really tell your husband today, hey, honey, I'm going to see my disease treater when you're 35 years old. It just doesn't sound good, disease treater. And it's not bad. Being disease treaters isn't bad, but people that don't have disease aren't getting any benefit going to a disease treater. Because all the patients with disease are in the hospital, but when you see your doctor in the office, whatever you're going in there for, he's going to give you a disease-based answer. And if you do what he says, you'll get the outcome. The proof of that is, people that see doctors and do what they say are going to live to be 72 to 82. But the people that live to be 90 to 105, which is the optimal human lifespan, they almost never see doctors. And so the problem is all these things you're seeing your doctor for in the outpatient setting, they're not diseases, they're abnormalities of your physiology, the function of your body, and they're abnormalities of your metabolism. And those things are occurring because of how you're living. So really, you need to change how you're living, but doctors don't know how to teach people to do that. Because what do? We're disease treaters. So the first debunk here is debunking the myth that doctors can do anything to make you healthier. They can't. They give drugs to give symptomatic relief, but that's all it does. And then the second thing is that we're just licensed drug pushers. I mean, people today more than ever tell me how sick they are of drugs, drugs, drugs for everything. And don't doctors know anything else? No, we don't, because we're disease treaters. Now, I do because after 10 years being a doctor, I got sick of being a licensed drug pusher and I began to study human health science. And that's what Dr. Debunk is about. What's the human health science that makes people optimally healthy at all decades of life? So I have 29 years of focusing on human health. So that's the second thing to debunk. You know, if you go to a doctor, he's going to bark drugs. If you look over somebody's fence and you're a stranger, the dog's going to bark. If you go to a doctor, he's going to bark drugs. He's not going to give you information that can change your life to permanently get you off blood pressure pills or diabetic pills, or deal with fibromyalgia, chronic fatigue syndrome, or headaches, and all the other things that you're dealing with as a non-diseased person that you would like to be better and not have these conditions. And so the problem is the system is built around insurance companies paying doctors to see you, not health professionals like naturopaths, who would do a lot better treating you for your high blood pressure or whatever else you're getting. But then you got to pay out of pocket. So today, this little introduction is about who Dr. Debunk is and what I'm going to be doing. And so every week, hopefully, I'll do 1 or 2 videos that'll be 3 to 10 minutes long, and they're going to be all over the place in social media. And so I'm encouraging you to tell your friends and people, come look at it. And you can judge for yourself who's telling the truth, mainstream medicine or Dr. Debunk. Because mainstream medicine is all about the government and the big universities and drug companies. The drug companies pay for all the medical studies. The drug companies fund all the universities. And the government kind of does what they're told. And they keep making more money. And it used to be you could still get health outcomes by doing that, but that day is over. That day is over. And so if you want to hear an alternative opinion about how to treat anything and everything, then Dr. Debunk is one of your sources. And there's more of us out there. And then finally, where this is going to go the next couple months is how to deal with the Martian virus. Because, well, the history of it, like I mentioned earlier, but also the Martian virus has come back. There's a new strain out there, and everybody's going all goofy, being afraid, are they going to lock down the world again, blah, blah, blah. No, I don't see how they can. They can only get so much traction out of it. This new version of the Martian virus is giving people a cold or flu. I've been seeing people every day now for 3 weeks that have the Martian virus, and you get a cold or you get a flu syndrome for 5 to 7 days. And nobody's even close to going in the hospital. But the numbers you'll hear, oh, hospitalizations are up, this is happening, there's hundreds of thousands of more cases. But the people that are sick in the hospital from the Martian virus, they'll be in the hospital if they got the flu because they have emphysema and they have major medical problems. So, but they're not going to tell you that. They're going to make it sound like, if you're 30 years old, the Martian virus will put you in the hospital. So I'm Dr. Debunk, and I'm back to start debunking all kinds of medical stuff. And we're going to start with the events of the last 3 years. Thanks for watching.